Well, I'm putting this as a reply to Jonah Hutchins. However, most of the discussions that I looked at, everybody had a great description of both CBT and narrative therapy and uh, clear answers to the questions that were asked. Uh, so there is no place to try to bring out anything else, but um, I want to take advantage of having this opportunity to reply, um, just talking about a concern that I have. Um, I know that as counselors and therapists, all of us would not just focus on one therapy or another, and hopefully we take a little bit of everything and come up with our own um, way of doing our counseling. And again, use all these tools with the right client, because going from Adlerian theory and therapy to something postmodern or modernist, um, you feel there's a bit of compromise in a way. And I even, in my own discussion, I talked about the fact that especially modernist theories um, are made to be more um, focused, almost laser focused on specific uh, problems and deal with those. It kind of reminds me of the time I used to watch this series MASH, which was a unit of doctors at the um, and the Korean War, and what they had to do is to give every soldier enough to patch them up and send them along for other things to the town in a way that was close, and to take care of him over there. They just had to keep him alive and put him together, put him back together. It seems to some extent this modernist is focusing on the problem at hand, and let's focus that and take that out of the way. But in the meantime, with the limited time and the limited applications and tools, um, 3 to 8 weeks. I mean, that's far, far um, different from Freudian therapy or Jungian therapy, which used to be actually almost 3, 4 times a week, and now it has been come down to about once a week. So that is the my main problem with it, and also the fact that uh, the therapists are not trained enough uh, to be able to deal with bigger problems. However, at the same time, I can see that the application of it within the counseling discipline to some extent works, because as counselors, we are community oriented, help people, and we have outreaches, and we are trying to deal with the things that are to some extent at the surfaces. But at the meantime, we do deal with a lot of children that have that are on the spectrum or some sort of disability, especially with language and behavior, learning disabilities, and to some extent, that kind of puts away the whole modernist from that part of the population, which in counseling is a big part of population. And also the fact that we saw, especially in the stands videos that we saw, that even with the concept of coming up with a theme for this narrative and coming up with the title, Stan had problems understanding and comprehending that. And the doctor was smart enough to realize it and bring it a level down and used externalization to help him out. And again, with the population that we might deal, especially on a multicultural level, and immigrants, and the lack of the language, these are a lot of problems, a lot of hurdles that we got to overcome if we want to use narrative therapy. Although it's for what it does, it's very sound, it's quite applicable within certain population, but not with everybody. So I'm hoping again that once we all start practicing, we are more judicious about picking the best of everything and applying it to the client. Because after all, this is all about them, and we are at their service. Thank you.